Good day, everyone. I am Reine Lantin, and my presentation today is on the impact of COVID-19 on diagnosis and treatment of tuberculosis in the Philippines in a healthcare provision and population-centric context. To start off, I want to give a bit of context to the tuberculosis cases in the Philippines. As the country with the fourth worldwide highest tuberculosis incidence, with 1 million of its residents having active tuberculosis, it is no understatement to say the country has an extensive history with respiratory disease. With this, efforts have been made to effectively locate and treat tuberculosis cases across the country. But with the arrival of COVID-19, these are greatly halted and even regressed. With how tuberculosis and COVID-19 affected the country, having both diseases simultaneously needing attention from the healthcare system, the country faced an issue of comorbidity, which is defined as the simultaneous presence of two or more diseases in a patient. This case was not just seen in people, but is also somehow seen in the country itself, where a split on addressing two deadly respiratory diseases at the same time. This research aims to analyze the impact of the COVID-19 pandemic on the treatment of tuberculosis in a population and healthcare-centric context, and to examine the positive and negative impacts of the adaptations made in tuberculosis treatment during the COVID-19 pandemic. Just to give more depth into why tuberculosis is such a massive problem in the country, 16.7% of the population is below the poverty line. This entails many health and safety risks, such as unsanitary and overpopulated habitats, lack of education, and lack of means to access proper healthcare, which ends up proliferating tuberculosis in the country. These socioeconomic issues that increase tuberculosis cases and incidences had made it so that the Philippines is one of the 8 countries that account for 2/3 of the estimated global tuberculosis cases, and is the fourth largest contributor of tuberculosis cases at 7% of the global total. Knowing that 1 million Filipinos are afflicted with the disease and about 70 Filipinos die from it every day, it is no surprise that treatment plans have been developed to efficiently treat tuberculosis patients to control the incidence of the disease, such as the National Tuberculosis Control Program, or NTP for short. Although this is the case, it is still a challenge to control the disease. With a constant incidence rate and an increasing rate of new and relapsing cases over the years, the problem of tuberculosis still remains a critical issue to solve, especially when the COVID-19 pandemic entered the country. COVID-19 hit the country hard, with 240,000 confirmed active cases at once, a total of 4 million confirmed cases, and 66,661 deaths since December 2023. It is no surprise that the country was basically put on hold, with most services being shut down due to the virus. Initial responses to the virus included standard COVID-19 precautions that were seen worldwide, such as the lockdown of homes, the use of face masks, and the like. Knowing this, adaptations were needed to be able to keep tuberculosis treatment up during the COVID-19 pandemic. One such adaptation that set the foundation for tuberculosis treatment during the pandemic was the adaptation of the National Tuberculosis Control Program. These changes and adaptations was applied and was called the NTP Adaptive Plan, and it can be categorized as create, test and diagnose, treat, and prevent. Screen would look for active or presumptive tuberculosis patients who have COVID-19 symptoms. Test and diagnose would test and confirm if these patients really had the disease. Treat brought the treatment to the patients through a home and community-based treatment plan. And finally, prevent aims to prevent tuberculosis from spreading and reduce incidence in the country, such as by providing tuberculosis prevention medicine to the people, monitoring those in contact with tuberculosis online, and the like. Even with plans in place, the healthcare system was still struggling. In this, we will now discuss the issues the healthcare system faced at that time. First off, the paper Experiences, Challenges, and Look into the Future in a clinical tuberculosis cohort in the time of COVID-19 in the Philippines gives us information from tuberculosis treatment healthcare workers and their experiences during the COVID-19 pandemic. From their experience, the initial government response, even if done for a good cause, ended up causing a lot of issues for them, such as the lack of resource delivery, healthcare services not being able to reach patients, and vice versa. Digital literacy and availability were also issues, with some patients lacking the digital literacy to operate the computers and phones that were required to contact their doctors, and in some cases, even lacked in technology entirely. Healthcare workers at the time were facing issues too, as there was a risk of catching COVID-19 due to exposure to patients, as there was also rampant anxiety and discrimination among workers, being in an unfamiliar field that everyone was afraid of. It was found that 28 to 38% of healthcare workers reported anxiety at the time. Tuberculosis patients also struggled with their mental health, as patients were fearful of COVID-19 at the time, and stigmas around tuberculosis treatment due to healthcare workers arriving in PPEs was seen as a bad sign. Next off, the paper Patient and Health System Related Barriers to Treatment Adherence for Patients with Drug-Resistant Tuberculosis in the Philippines, a mixed method study, also showed the population-based context of what tuberculosis researchers saw during tuberculosis treatment and how patients and their personal lives affected treatment. One of these was that due to the factors of patient lives, such as their livelihood and the financial burden of the treatment initiation and retention was low. So there were some cases where patients would end treatment early due to feeling quote unquote fine. The perception of tuberculosis treatment among patients was a concern, as stigmatization in the community was something they believed that would happen. Family-related issues also came up, as there was sometimes a lack of psychological or resource support from patients' families, causing halts in treatment. Throughout the pandemic, opportunities have arisen to implement plans and programs to optimize tuberculosis treatment in the country. One of these was the move to home and community-based treatment, like I mentioned before. Due to the fact that some patients are far from treatment centers, shifting the focus to bringing the treatment to them helped make it easier to treat communities. The use of digital technologies, even if it was seen as an issue in some cases, to contact and remotely monitor patients also brought improvement to tuberculosis treatment. Nurses were able to digitally monitor their patients, removing the need to observe them physically. To better combat the lack of resources and supply transportation at the start of the pandemic, motorcycle drivers were tasked to transport supplies needed by tuberculosis patients and samples needed by laboratories. Finally, continuous quality improvement, or CQI, was implemented, which is a process to help clear bottlenecks in a system or a plan. By using this, healthcare workers were able to optimize tuberculosis screenings and increase testing rates in the country. In summary, the paper aims to analyze the impact of the COVID-19 pandemic on the treatment of tuberculosis in a population and healthcare-centric context, study the adaptations made in tuberculosis treatment during the COVID-19 pandemic, and examine the positive and negative impacts of the adaptations. Throughout the research, we were able to see that the initial government response to the COVID-19 pandemic affected most tuberculosis treatment services, with many of its pre-existing issues amplified by the pandemic and many more issues coming to light. This then called for the adaptation of the National Tuberculosis Control Program to the current situation, with innovations in tuberculosis treatment added in to improve efficiency. After time, we were able to see how much the healthcare system improved after being challenged with the comorbidity of tuberculosis and COVID-19. In terms of recommendations, more research on the patient-level context would have brought more information on how the two diseases actually interact in a single patient, which would have broadened the understanding on the case. More information and graphs on the effect of COVID-19 responses on tuberculosis treatment would have also made it more clear on what the effect of the pandemic was on TB treatment. Finally, first-hand information and interviews from healthcare workers and researchers who worked on the tuberculosis treatment and patients who received tuberculosis treatment during the pandemic would have shined a light on how it really was back then and how these issues affected not just the system, but the people who work and rely on it. Altogether, this paper was a success. Even through struggles and strains, the Philippine healthcare system was able to show its resiliency. It adapted and improved itself to be able to be more effective and equitable, being able to reach more people with less resources needed. This case can hopefully be an example to future comorbidity cases on what could possibly happen and what issues they can face in tackling their own cases so that they can make their own adaptations to these issues. Thank you all for listening to this presentation. Here are the references I used in the creation of this paper. And if ever you want to contact me for questions or inquiries, feel free to email me at reinlantin@gmail.com. Once again, my name is Reine Lantin, and thank you all for watching.